Good morning and welcome to our annual AFSPA member meeting. Now, a few years ago, we decided to move the member meeting from January to March due to the inclement weather. But now, today, the government is closed in Washington, D.C. We are right in the middle of a nor'easter with 60 to 70 mile an hour winds. So much for good planning and changing the member meeting. But luckily, we have a lot of technology with us, and it allows us to come to you no matter where in the world you are. So thank you very much for attending, and I'm sorry I couldn't meet you live at the office. So let's get started with our meeting. The first up is I want to just remind you about the Affordable Care Act and the individual mandate requirement. Now, you should have received a 1095B from us. I got mine in the mail last week, so we did mail it by sometime last week, and you should have it. Annuitants have retired before 2017 would not receive a form, but these forms are part of the mandate that just shows and proves that you did have essential health benefits through the year of 2017. You do not need to attach these forms to your tax return, but you should keep them with your 1040 return, like you would do your normal charitable contributions and things like that. Your 1095 forms are not required to complete your taxes. A word about migration. This is the fourth migration we have gone through in about 30 years. And as I've warned, it will be painful. And we have talked about this for several months regarding what we can expect for migration. And we got about what we expected. What we expected was some things didn't come through like we thought they would. We tried to talk about this in our newsletters. We announced it actually in the spring of 2017. We gave more details in the summer of 2017, and there was additional details in the fall. So we did it through electronic messaging, through Facebook. We had dedicated pages on our website, and we also did it through open season messaging and we included a full migration brochure in the open season packet for you. Even after all that, there were issues, and I want to go over just a little bit about those issues. Now, remember, the last one we went through was probably in early 2000, and this is part of normal business practice. Of course, back then, at the last migration, a lot of things have changed. We didn't have the online filing for our members. We didn't have the member electronic funds transfer. We didn't have a lot of our direct billing partners overseas through the hospitals with their own electronic filing and their own currency. In addition, we expanded our online activity through the wellness programs. For example, you can also look for in-network providers. You could check your claim status. You could review your prescriptions and your refills. So we've made a lot of changes, and healthcare is very complicated, and it is essential for a plan to keep up with the technology and to keep up with healthcare. And having said all of those reasons as to why we had to do this, and the difficulties that we had through the first days and continue to have to a smaller level of migration. If it's your claim that is being delayed, we understand, and we are working tirelessly every day to fix whatever issue we have with you with the claims process. So going through what we did, when you called our office in January, you were shocked, as we were, at the longer hold time. We took over 700 calls on January 2nd. And that was a lot of calls even for us. So we were disappointed, as I'm sure you were, about that longer hold time. We did add additional staff. We tried to put information for you during the whole time, and we were able to give you a callback option, and you didn't lose your place in line. We also provided online access. We did it through recorded on hold messaging, and we also did electronic messaging to our members. Some of the challenges that we faced during this migration process, many of you did not receive your ID cards on time. Late receipts, maybe your name was not spelled correctly, or the dependent information wasn't on there correctly. We did take fast action to solve some of these member issues, and we did move up in line as far as priority printing for the Foreign Service Benefit Plan ID cards. As far as claims go, there was longer processing times. We did have to hold the claims for 2018. We did expand and expedite quality reviews. There was so much coding that came through from 2017 from the old legacy system to the new 2018 system. We did hold those claims, go through the quality process, the quality reviews, and we were able to release those claims. We asked for additional staffing at Aetna to process the claims, and the inventory is improving. And we just ask that you are patient with us. As we see things that are not quite right with your claims, we will hold them until we find out what is going on, and then we will release them. We will try to keep you as updated as possible, but it is vitally important for those claims to be correct when they go out our door. Another thing we ran into was the member electronic funds transfer. Now, remember, Aetna does a lot of, they're a big company. They do a lot of employer group plans where it is the employee only that has the checking account or the bank account. And they weren't used to the association member group where we may have a spouse, a husband and wife, going into the same bank account through electronic funds transfer. So that didn't work. We are working on a solution for that. In the meantime, one of the members will receive paper checks until we get that solution worked out, and we are working towards that now. We will keep you informed and notify you when the fix is in place, and we can once again offer full member electronic funds transfer to both members to the same bank account. Another thing that went through that we've discovered was the Medicare coordination of benefits. We did have a few issues with that. To about maybe 300 of our members, we had to halt those processing. We identified the issues and we implemented a solution to that as soon as we possibly could. I hope that is fixed. If it isn't, I'm sure you will let us know, and we will again get right on it. We did have a few issues, not many, but a few issues with the Express Scripts enrollment. That was handled right away. We were able to manually add members. When we found out about it, we identified what the underlying issue was, and we have resolved that. So that is the report on the migration. I'm sure that there's a lot of things that I have not covered, and we continue to receive information from you on what is not working, and truly we appreciate that, because sometimes we don't know if it isn't working unless a member tells us. So we do welcome that information from you. We thank you for your support in this, and also for your patience. Now back to the report, how we did in 2017 for the Foreign Service Benefit Plan. Open season was fantastic for us. We actually processed almost 3,000 transactions in this office. We gained over 1,900 new enrollees, and we received only a little over 400 terminations. Our total open season growth for just open season was almost 1,500 members, which we are very humbled and very thankful for. Our total enrollment in the Foreign Service Benefit Plan now stands at almost 31,000 enrollees, and now we are responsible for over 72, almost 73,000 lives. And we thank you for your loyalty on that. As far as some of the claims and operational statistics that I want to go through, last year, this is an incurred estimate, we paid over $300 million in claims. Almost 1 million claims came through, 980,000 claims actually came through our system, and over half of those were filed electronically. As far as the operational results for 2017, of the 980,000 claims that were processed, we processed those at a 99% claim processing accuracy, and over 95% of those claims were processed within 15 days. When you called our office, we actually received over 160,000 calls, and 90% of those calls were answered within 30 seconds. And I know you don't believe that, I understand that, but remember, these are 2017 statistics. In January, I can't tell you that's what happened. I can't tell you that's what happened in February, but I can tell you that things are getting better, and I can promise you that we work every day to make sure that you receive the same time service from us this year as you did last year. Our written correspondence, we received 131,000 written inquiries from you, includes over 23,000 emails, and our time service on that was 95% within 5 days. Let's talk about prescription claims. That was quite a bit of our claims processing. We filled almost 500,000 prescriptions last year, and that was at a cost of over $60 million. The Foreign Service Benefit Plan continues to pay about 86% of the total prescription costs for our members. Specialty drugs, those high-cost biologic drugs, do continue to increase. The plan cost for 2017 for those specialty drugs was over $25 million alone, about a 27% increase over 2016. That accounted for almost 43% of our total drug cost, and specialty drugs were utilized by only about 4% of our members, about 2,800 patients. 175 patients had drug spend of over $50,000 each in 2017. And we were very glad that we could, on average, cover about 86% of the total overall costs. But that leads me, we are not the only plan that has these high cost drugs, and that remains a priority under the entire FEHB program. One of OPM's initiatives for this year, again, is managing prescription drug costs. Another is access to care. They have put in population health, which is still wellness and safety. It's just a new name for that category. So let's talk about managing prescription drug costs and what we are doing with that. We continue with our utilization management programs with prior approval, with step therapy and quantity limits as defined by the FDA. We are move patients to generic when that drug patent expires. And this year, we're very excited for the first time to offer our Smart 90 program, which offers the same savings at retail, at your pharmacy, for a 90-day supply, for which is your maintenance drugs, that we do with our home delivery service. So we were very happy to offer that. As far as our web-based interactions go, you can refill your prescriptions online. You can actually contact a specialist pharmacist who is specially trained in the field of your condition. There's a lot of information on the website for our formulary tiers, as well as a cost calculator, so you can actually see how much that specific medication will cost you. We continue to improve our digital innovations and assistance programs with our partners at Express Scripts. We have on-demand support. You can actually look at your medicine cabinet and get your refills, whether it's online or through your smartphone. We have developed interactive support for example, for our diabetic patients through our new program with Livongo, which is, I'm very excited to offer this online, this cellular-based program to help support diabetic patients. And of course, we have our Credo, which is our specialty copay assistance program through our specialty pharmacist, Credo. And last year, they were able to assist our members to the tune of about $125,000 in support last year. Access to care is another initiative, not just for OPM, but also for us. One of the major things that they look at is the out-of-network providers that work in an in-network hospital or facility. This also was one of our questions we received from a member. As you know, there's a lot of out-of-network providers that do work at the hospital. They are not within our network, and they do charge accordingly. What we have done for, of course, several years is we do provide that benefit for out-of-network emergency providers. We call them hairpin providers, and these are hospitalists, anesthesiologists, intensivists, radiologists, pathologists, emergency room doctors, and also neonatologists. If we receive a bill from them for you while you are in a hospital inpatient, we do pay that at 90% of the plan allowance. So I think that it is a great benefit, and I will talk more about that in the question and answer section, because I have more information based on one of the questions a member wrote. Our telehealth services continue to expand, and we do want to enhance that service. We actually expanded that service this year to include benefits for video visits to a U.S. provider who use HIPAA compliant tools for our members who are overseas who need that specialized behavioral health support. As far as population health and wellness, our programs we are very pleased to have many programs that promote healthy lifestyles. We offer a lot of wellness incentives, which are in the brochure. We also have programs to address serious health issues, for example, diabetes, and our opioid support programs. A little bit about opioid. It's common knowledge that the United States is in an opioid epidemic, and the problem is unbelievable here. 70% of abused prescriptions are actually provided by friends or family through old prescriptions that they have, like in the medicine cabinet or things like that. 6 out of 10 overdose deaths now are involved with an opioid, and we have 2 million people who are addicted to opioids just in the United States alone, and that is really a very scary number. So step back a bit and imagine if we treated this epidemic like another health crisis, like Zika or something like that. Remember when we hopped on that? or we actually treated it like a consumer crisis, like what happened with the airbags. Well, the time is now, and we are taking action. We are treating this like one of these crises, because that is exactly what it is. It is a crisis in the US. So we do have comprehensive solutions at every touch point, whether it be at the pharmacy itself or at the member level, where we are offering support programs, and we are, for example, we are mailing things like bags that you can put your medications in so that you can destroy them, things like that. There's more information about our opioid program online, and we will continue to support anybody with an opioid issue. I love this slide because it reminds me, and hopefully you, of how things used to be. And it was very touch point, it was very one-on-one. And this is the past reality. Actually now, this is our healthcare system. And this is not a cartoon, it is not a caricature. It is actually pulled from the Department of Health and Human Services website. So it is so very important that we provide you with the programs that you need to keep healthy and stay healthy, and give you what you need in support, which is why we were one of the first to offer a telehealth benefit, which includes telehealth consultations via video visits through a web or even a mobile device. You can actually talk to a doctor, registered dietitian, a clinical social worker, and psychologist. And you actually can address most common issues. See a therapist for ongoing counseling, and care is available 24 hours a day, 7 days a week when you need it. And if you want more information about that, please go to page 33 of our 2018 Foreign Service Benefit Plan brochure and sign up for it. Now, clearly, this is not to replace your PCP, your primary care provider, but it is a way to meet you where you are, like we have tried to do and develop programs around that. Our goal is to bring healthcare closer to you, to not just telehealth, but the convenient care facilities at a CVS or a Walgreens here in the States. Urgent care centers is another push that we have, and there's a specific benefit for urgent care centers. Of course, your doctor's office, we are not trying to replace that doctor's visit, but we are trying to give you options. Of course, if you have a medical emergency, go to the emergency room or call 911. But this is our goal in bringing healthcare closer to you. Now, some of the other benefits and programs that we have available to our members, and I try to pick out the ones where I hear that when a member says, I didn't know you had that, or I didn't know we could get that. So I just want to review a few of our maybe little known programs. We have the Quest Diagnostics outpatient laboratory benefit, where you can, in the United States, you can get 100% of your labs paid. I'm sorry, your labs paid at 100%. Now, this is a voluntary program. It's not required, but it is there for you. And I do have an answer to one of the members' questions. If you are online, I'll get to that in a minute. We also provide adult hearing benefit for adult hearing aids, foot orthotic devices as well. As you can see, our main focus is on your wellness, and we do have a very generous alternative benefit package with chiropractic and acupuncture benefits that are separate, as well as massage therapy. The Foreign Service Benefit Plan continues to be the only plan that provides an actual benefit for massage therapy. I also want to remind you of our case management program for serious illnesses that you suffer, and you have access to a nurse who can walk you through any questions you have and make sure you are comfortable with where you are in your medical care. So don't be surprised if one of our nurses call you after you have been released from the hospital, just to make sure you understand the discharge orders, go through your medications, then they will check up to you like a normal friend would. We also have a therapies cuisine program, and this is specifically designed for cancer patients. And I think it's very important, especially and for anybody who has had cancer and has gone through chemo or radio or radiation therapy. It's tough, and you may not have your appetite, and it's so important to understand what foods you need and what you can and cannot eat given your limitations. So this program is specifically designed for cancer patients. And also our advanced illness program, and this is not to be confused with hospice. This is an advanced illness program that is really designed to support the entire family, and it's a quality of life support that is very, very valuable for the entire family as they go through the advanced illness. And all of this information is available to you in our brochure. So I just wanted to go through these maybe little known programs and services that are available to you. So in the perfect world, if we were in the office and I was able to have the on-site meeting, all of these services were going to be demoed to you, and we had people fly in. Thank you very much, Aetna, and thank you very much, Express Scripts, for flying your people in to demo these. We will, for our members, we will have the demos to you and available online within the next couple of weeks, so that you will receive that demo, and we'll make sure that you know that those demos are online. But just going through the information for the Foreign Service Benefit Plan, this is our member portal. It is our online customer service where you can update your address and you can file your claims. You can also do a link to My Online Services, for your 2017 claims information, for Aetna Navigator for your 2018 claims information and all of those new wonderful programs that are available, as well as Express Scripts for your pharmacy information and medication information. The new Aetna Navigator system looks like this. This is where you would sign in to check the status of your claims, to have access to your explanation of benefits, and to also have access to all of those wellness programs and member engagement programs that we offer through Aetna. This is where you would sign in for your Express Scripts online customer service, and this is how you would refill or renew your home delivery prescriptions. You can also compare prescription prices and not only locate a pharmacy, but find out what that pharmacy would charge for your prescriptions as far as the co-insurance basis. So there's a lot of information that is available to our members online. And again, I wanted to be able to provide demos to the membership, and we will do that, and it will be available to all membership online, and we'll let you know about that. We also want to let you know about some ancillary services that you may not be aware of. The Protective Association continues to offer 4 individual life plans, 4 dental plans, 2 disability plans for long-term disability. We offer members of household insurance for those employees who are going overseas and are taking a member who may not qualify for the FEHB program. Parents, even though they're on your orders, children over age 26, domestic partners that may come over with you that are not married. We do have long-term care planning, as well as legal services available to you, financial planning, travel assistance for when you are traveling, need that extra benefit, and that's available to family members as well. And tax consultant services are also available. And we've added a couple of new programs that I want to go over. We're very pleased to offer a dental and vision and LASIK discount program. Now, this is not to be confused with the actual insurance programs that either we or the Federal Employees Dental and Vision Insurance program has. Sometimes people don't want to buy a full insurance program, but they want some protection. And we were able to find these programs, these discount programs that really fills that gap between no protection and fully insured protection. You do have access for the Carrington Dental Network here in the States, and it offers actually a 20 to 60% savings on both routine and specialty treatment. As far as the dental, as far as the vision goes, that those services are through the VSP, and LASIK is also in 40 to 50% discount over overall the national average cost of traditional LASIK, and there's about 800 locations nationwide. Our True Hearing program we're excited about that because that is a program that is free to all AFSPA members. It is a 30 to 60% discount from the national average. There are over 3,800 providers nationwide, and if you use this program in addition to the Foreign Service Benefit Plan benefits of your hearing aid benefits in your FSBP program, you could have a substantial savings for your hearing aids. Again, there is more information about these discount programs. They are not insurance programs, and more information is available on all these programs to you on our website. As you can see, our goal is to really surround you with care, with all of the benefits we offer, the wellness programs we offer. I remind you about the wellness programs. They are very important. Support programs, if you need it for those serious health conditions, cancer support programs, things like that. Our ancillary products, we constantly are looking at providing you ancillary programs and products that make sense. Our customer service, we are very passionate about serving you. We have competitive premium and benefits, and of course, considering that our diverse population everywhere in the world, we do offer a lot of online services that are available to you. And I encourage you to just go to our website and look around and see things that you may not have known of and may surprise you. Our commitment to you for all of this is, again, providing you the programs and services, the websites, and more, so that you have a comprehensive view of the healthcare that is available to you. But I also understand that can be confusing. There is a lot. The good news is that there's a lot of information out there on our website. The bad news is there's a lot of information out there on our website, and it can be confusing. So our goal is to help you understand it all and to provide you with unparalleled service that you have come to expect from us. And admittedly, we have fallen down a bit on that in the last couple of months, and I promise you that we fight every day to get back to where you expect us to be. So at this point, what I have done as far as the question and answer section of the program, I got a lot of questions. Thank you very much to those members, both who RSVP'd to this annual meeting, both on site and through the webinar. We are actually broadcasting all around the world to our members everywhere. I pulled out the general questions that were common to several of the and if you wrote a question down and we didn't, and I'm not answering them right now, we will reach out to you individually and directly within a week or so to talk through those specific questions. And this full webinar will be posted online to all of our members. My IT people tell me by next week, and also it will include related materials that are actually sitting on a table in our office and we don't have right now, but they will be available to you online. So let me go through some of these questions. A comment came in that it just seems that the Foreign Service Benefit Plan has more bureaucracy around it, and it's just harder to get us to process and pay claims. And I understand exactly where that's coming from. So in several newsletter articles, and actually I sent a letter to the membership in February of 2016 about this. Here's what happened, and I'll explain it again. We have prided ourselves on trying to understand what our members, especially overseas, are going through, and trying to make it as easy for them as possible, as easy for you as possible to file claims. And sometimes we looked at a gray area, and unfortunately the Inspector General thought that our area was a little too gray, or our gray area was a little too wide, and really advised us in a nice way to make sure that we were following the contract and we were getting the information that we needed on all claims, and which is in section 7 of the brochure. So admittedly, yes, we are asking for more information. We are making sure that we get the information that we need to process the claim accurately and completely. So I can understand why you think that there may be more bureaucracy, and I apologize for that. But unfortunately, we are required now to get the information that we have actually needed for years and have just tried to work within that gray area. Another question came in about when the wellness incentive will be activated, because it's not quite on the new Aetna Navigator system. And let me explain. The wellness incentive funds earned in 2018 are populated as soon as they are earned, but there is a lag time of up to 4 weeks to go through the system and to post it on your site. Members will receive reimbursement automatically for the claims that are processed in 2018 that you have member responsibility. For example, if you already took your HRA and we have that information, that money is sitting there, and if you file a claim for your deductible, we will take that. So you will get credit for that. Members can claim, of course, you can claim other eligible medical expense as developed by the IRS by submitting the claim form and the itemized bill per the direction in your brochure. Now, if you still have incentive funds that were earned in 2017, they right now are sitting on the Coventry system because that is how they will be paid. All right. And then if you still have funds on May 1st of 2018, that will migrate back to the new Aetna Navigator system. We chose that date, May 1st, because that is in connection with the FSA Fed's filing deadline of April 30th, 2018. If you want your funds sooner, then please contact us and make the request, and we will see what we can do about that. Another question was on the discount program. I did have somebody who was going to be available to talk to our on-site members about that. I tried to put that in the presentation. The information is on our website, but for those who asked about that, those individuals who asked about the discount programs, we will reach out to you directly within the next week or so and be able to walk you through that. Another question that came through was, why do we use Aetna? And a little history lesson here. The Foreign Service Benefit Plan was with Mutual of Omaha Insurance Company from 1942 to 2007. We were their oldest and very first group client. And in 2007, the president of Mutual of Omaha made a very difficult decision, understanding that as healthcare became more and more complicated, and especially in the federal system when there were more and more requirements on them. They chose to sell their federal business to a company called Coventry. And we were very happy with Coventry. We were with them from 2007 to 2012. When the Affordable Care Act came into play and you saw all of these hospitals combining and getting bigger and bigger, and they're buying up physician companies and getting bigger and bigger, it became evident with Coventry, which was, by the way, a mid-market company, that it was going to be harder and harder for them to compete in the bigger market. So the entire company, Coventry as a company, was sold to Aetna in 2012. Now, Aetna is not new to the federal program. Aetna has decades of experience in the FEHB program. For those of you who remember back in the mid 80s, the Big Six, and it was part of that Big Six there. And they have decades of experience not only with the FEHB program, but with our group as well. One of the best things that I can tell you is, while they may have changed companies from Mutual of Omaha to Coventry to now Aetna, what we get are the same people who have been processing our claims for decades. The same people who are working in the Gastonia claims operations down there were Mutual of Omaha people and came over from Mutual of Omaha to Coventry to Aetna. Our account team, the management team, came over from Mutual of Omaha, from Coventry to Aetna, and even a lot of our clinicians, our clinical team, has come over from Coventry to Aetna. So they have a lot of experience with our group. They understand the passion that we feel for you, and they share that passion. Change is hard. I know that change is hard, and I believe that Aetna, in spite of what's going on with migration right now, Aetna is a good company and really does strive every day to bring us the best service they can. The next question was about the Foreign Service Benefit Plan and the interaction with FSA feds. And that was a difficult process last year. I understand that. A little bit of history here. When FSA feds first came into play, there was a vendor called CHIPS. And in 2016, that vendor changed from CHIPS to what they call WageWorks, and they became the administrator of FSA feds back then. And it was not a smooth crossover. There were, again, when you're talking about computer systems and IT, things did not go as planned in many cases. The issues are now resolved. A reminder that you do have until April 30th to submit all of your 2017 claims for reimbursement to FSA feds. Members can submit them directly to FSA feds as well. But I do think that with the relationship with the Foreign Service Benefit Plan and FSA feds, that we have all the kinks worked out now. And as far as I know, that process is running smoothly. And if you experience something different, please let us know. And we are happy to look into it, of course, for you. Another member asked a question, and this is a question I get a lot, is why don't you offer silver sneakers to us? And the simple question is, according to the IRS code in 502, which handles this, we cannot include memberships in gyms, health clubs, or spas as a medical expense. So the straightforward answer to you, to members regarding the Silver Sneakers program, which is a fantastic program, is if we would offer it as a benefit under the Foreign Service Benefit Plan, the IRS rules that it would be a monetary value to you that they would have to consider taxable income. not only to the members who actually use Silver Sneakers, but to every Foreign Service Benefit member over age 65, even those living overseas, and even if you do not use Silver Sneakers. So clearly we did not want to do that and have you incur taxable income. However, we do have access to discounted prices at specific gym memberships through Aetna, through what we call our Global Fit product. And I checked out some of the gym memberships just in our area here in Washington, and they actually include several of very well-known plans. LA Fitness is one, certain Washington sports clubs is another, certain curves, and even some yoga salons are included in this. It also includes home exercise kits and much more. I'm very impressed with them. So for those members who are here, I encourage you to go to our website, go to the brochure in section 5, and actually just look at what our Global Fit discount program has to offer you. Another question was, what if was regarding the Quest lab? What happens if the doctor does not does not use Quest lab? So on page 35 of your brochure, here's what you have him or her do. You have them write a lab order, and then you follow the instructions on page 35. You can find a lab, a Quest outpatient lab. They are everywhere, it seems, in here. And then you take that lab order, and they will do your labs, and you will get that 100% benefit. Now understand, you're not required to use Quest Lab. This is strictly a voluntary program that will enable you to receive your lab benefits at 100%. But so hopefully, and if you need more information about that, please feel free to send us an email or call us, and we'll be happy to walk you through that. Another question was about the out-of-network doctors in an in-network facility, and I talked a little bit about how we pay those doctors. We pay them at the higher in-network percentage at 90%. But if a member, if you are balance billed meaning you do get a bill after we pay for a hair care provider, you should call us. You should refer and what we would do is we will refer the issue to Aetna, and we will talk to them. And if the provider still insists on billing you, then we will adjust the claim. But this is our way. While we cannot force these out-of-network providers to reduce their fees, we certainly can help you out. So we are happy to do that. If you run into that scenario, just give us a call and we'll see what we can do. Another question was how to submit a claim online and how to read the explanation of benefits. Well, we were going to have a demo on that, and we won't today, but we will within the next week or so. So we'll actually be able to walk you through those instructions for submitting a claim online. As far as how to read the explanation of benefits, that was in your migration handout that came out during open season. And I understand that these explanation of benefits look a lot different than the old explanation of benefits you received last year. Change is hard. We will get used to this. If you have any questions about the explanation of benefits, write us. We'll be happy to walk you through it. Call us, whatever. We want you to be comfortable with the information you are receiving. Just a few more questions that I have from members. Another one was our policy regarding when a physician prescribes a drug and it hits our formulary review, what happens and who makes that decision? And who makes the decision as to what drugs go on our formulary, whether it's the preferred list or the non-preferred brand, the tier 2 or tier 3, or which drugs are excluded. And I wrote an article about that a couple of years back, and it's actually in the middle pages of our summer of 2016 AFSPA in Action newsletter that is on the web. We post all of our current and former newsletters on the web. I will tell you that this article does explain the different independent committees that work on the drug formulary. But let me walk you through a few scenarios here. Say that your physician appeals a decision about your certain drug. So the physician will get a letter and will explain the reason why the drug went from either non-preferred to preferred, or whether it was excluded, whatever. And the physician is asked to provide additional documentation to support this appeal request. Now, the committee that looks at this is what we call the Appeals Decision Committee, the ADC. It consists of 2 pharmacists and an independent physician. That committee meets and reviews previous and new information that is provided by your physician. Now, if that is a second level appeal, that appeal goes to an entire different set of pharmacists and physicians. So the same 2 committees are not seeing this. The same committee is not seeing it. You asked what criteria. The denial reason is really depending on the type of drug, what the FDA says about that drug, as far as what indications, what the medical diagnosis is for it to be used. So again, the people who are making these appeal decisions are not us. They are not the customer service reps at either on my team or on Express Scripts team. They are clinicians and experts in their field, and they are totally independent from either one of us that are making this decision. Another question, and I have just about 4 more questions, is what's going on with the FEHB and the Affordable Care Act? And will the changes in the Affordable Care Act have any effect on the FEHB program? And in the short term, I can tell you that the FEHB program consists of 262 health plans. The Foreign Service Benefit Plan is one of those programs. It's one of those plans. And OPM is really focused now on quality and outcomes. They are focused on making sure that the plan offers you good quality benefits, and the physicians in the network are of good quality that can help you with good outcomes. They are focused on what we are doing to support you as far as our services, our responses, and our benefits. Another focus that OPM has is on incentives for Medicare enrollment. All of the plans, all of the fee-for-service plans in the programs, like us, waive most of the deductibles and both for hospital and medical coinsurance and copays. And many of the plans offer lower prescription copays. So that's what OPM is focused on. OPM is also focused on what they call a data warehouse. They want the plans to share the data so that OPM can really assess their employees' practices so that they can create better negotiations and a better and stronger program. Every plan, including us, is working with OPM on sharing the de-identified HIPAA-compliant data information so that they can meet their goals, and we can continue and will continue to protect your information. Long term, you know, of the newly formed tax brackets that they just talked about in the new tax bill. I will tell you that it does not change how we look at, how OPM looks at the CPI index. There is talk about having the premium increases, the premium support from OPM, from the government, be hooked to COLAs and things like that. That's a talk, and I don't know whether it's going to happen or not. It's been around for a while, but nothing has moved. I will tell you that there is also a talk on mandating Medicare Part B coverage for all FEHB annuitants. I also will tell you that has been in talking stages for a decade now, and there hasn't been a lot of movement. Don't see a lot of movement right now. The latest budget proposed, however, does look at changing the government contribution for the FEHB plans from what it is now, which is about an average of 72% of the premium. They are looking at adjusting that and attaching that to a contribution based on the plan performance assessment, which will range from anywhere from 65 to 75% of the plan's premium. I don't know how that will work. The budget has not been approved yet. I don't know if it will fly. I think that we're pretty safe right now. I can't tell you what's going to happen in 2020 or 2021. But those are the only things that I have seen that are on the horizon regarding the FEHB program. Your FEHB program is strong. It's active. It's innovative. And I think that as a federal employee and a federal annuitant, we are very lucky to have the FEHB program. Another member asked, a couple of members actually asked about the Aetna and CVS merger that they heard about back in October. And I sent a couple of emails out to the membership about this. Aetna is going to retain its name. Now, none of this is worked out yet. It has to go through Department of Justice, and that might be the later half of 2018. Aetna is going to retain its name and will operate as an independent company under the CVS family. All operations, including what we have now, claims operations, clinical operations, underwriting operations, management operations, will be retained by Aetna. As healthcare gets to be more complicated and hospitals and physicians get to be bigger in their networks, this is a good thing. I think I can see, I know that people are nervous. I was a little bit nervous when I heard about it, but I can see there's a lot of good that may come out of it. We will retain Express Scripts as our prescription benefit manager, but Express Scripts does not have bricks and mortar store. CVS has bricks and mortar stores. CVS actually is a participating retail pharmacy under the Express Scripts umbrella and will continue to be. So even though members are not required to refill their retail prescriptions at a CVS now, nor will they in the future. They continue to have a choice of hundreds of retail stores across the country. How I see this benefiting us, this merger, as they talk and look at ways to bring healthcare closer to the public through their CVS mini clinics, what we call their convenient care clinics, and have that as part of their network. I can see where it'd be more convenient for a member to go into this expanded mini clinic that isn't just for urgent care or sore throat, but maybe for physical exams, maybe for getting lab tests, things like that. So I can see the potential here. I don't know where it's going to fall, but I think that we will be just fine either way. So I'm actually kind of excited about that. A couple of weeks ago, There was an article that hit the news about an Aetna medical director in the state of California that was being investigated, and a couple of members asked about that. So I do want to address that here as well. The Aetna employee that is involved in this case works for an Aetna commercial independent HMO in the state of California. We have a separate team of medical directors that work for the Foreign Service benefit in Arizona, actually. These medical directors review medical information, including all medical records that we receive, to make an informed decision on an individual case. And they base that on standard medical guidelines. In many cases where they feel it's necessary, they engage in what we call peer-to-peer conversation with the treating physician, so that the Aetna doctors understand the physician's outlook. If a member or a provider files an appeal on a decision, the original medical director is not involved in that appeal. Their training is extensive. There's no financial benefit for them denying anything at all. Now, earlier this month, we actually met with our partners at Aetna, including some of the medical directors that deal with the Foreign Service Benefit Plan. Their training is vigorous, it is ongoing, and they have a lot of quality reviews that they look at every single year on each and every medical director. Any decision that those medical directors make is based on medical appropriateness, and they follow and what they do is they look at that, they base it on the statistics that are out there, the medical necessity, the medical appropriateness of a hospital stay or a procedure, and they base their decision on the medical information they receive from the physician as well. Another member asked about the long-term care costs in the Washington, D.C. area. And I looked it up, and in D.C., a private nursing home room is averaging about $10,000 a month. In the state of Maryland, it's about $9,900, and in the state of Virginia, it's about $7,900. Now, I have this information from a 2017 survey of that was done by Genworth, which is an excellent company. I had handouts in the office, of course, but we're not in the office. So we will again post that link onto when we release this webinar, so that you can look up the information, not just in the DC, Maryland, and Virginia area, but throughout the entire country. And it also has information on semi-private rooms, how much a home health aide might cost in your area. It's a very good resource to have. And finally, somebody asked, will changes in the Foreign Service personnel change the demographics and cost structure of the Foreign Service Benefit Plan health insurance, resulting in changes in our premium or coverage? Clearly, this came from an underwriter, because those are the exact words I would use. So here's what I can tell you. The Department of State has authorization to hire foreign service up to 25% of attrition. Right now, we have 8 new hire classes that are scheduled between now and September. So I think that while there will be change in the Foreign Service, that we are getting these new classes in. The Foreign Service Benefit Plan, however, is experience rated, which means that our premiums are based on the healthcare experience of our entire membership for the last 18 months or so, and what we can look at potential trends into the future. How many transplants we expect, what is the drug trend going to be, what is just the general cost of healthcare going to be, things like that. We have a very healthy group. The average age of a Foreign Service Benefit Plan member is around 40. 63% of our members are in the well or acute stage of health, meaning they rarely go to the doctor. 31% of our members are chronic, meaning they do have a chronic condition like diabetes, high blood pressure, things like that. And only 6% of our members are in a complex state of healthcare, meaning they have really complex conditions that require a lot of healthcare, expensive healthcare. We have, as you know, tons of management programs in place, not only for member engagement and better outcomes, but also to manage costs. We feel that if we can help and support the members in that chronic stage, it will help them and prevent them from going into the next stage of a complex stage. And that's what our goal is. Our reserve position is strong. And all in all, I think that the Foreign Service Benefit Plan will be around to serve you for a very, very long time. Our benefits are good. Our premium is very competitive. Our outlook is strong. We have good reserves in place. We are really in a good position with the Foreign Service Benefit Plan. If I have not answered your questions, again, we will look at the ones that you posted when you sent in your RSVP, and we will make every attempt to contact you individually over the next couple weeks or so. So we will reach out to you. If this has posed more questions for you, please feel free to write us, and we will put that in the stack to answer you specifically. But this meeting is about the Foreign Service Protective Association and the Foreign Service Benefit Plan and what we are doing, not just now to serve our membership, but to serve our membership well into the future. So now I'm going to break a bit, and I'm going to move into the short Medicare update for those of you who are interested in that. So if you are not interested in Medicare, then please feel free to drop off of the webinar. Thank you so much for your attention to that, and I hope that we have been able to answer some of your questions regarding the state of the Foreign Service Benefit Plan. Good morning, I'm back. And now I'm going to talk about Medicare and the FEHB program. I'm not going through the whole presentation because it'll probably put some people to sleep, but I do want to talk about some of the changes that has happened in Medicare and in the FEHB program, so that you know about the different types of physicians and things. So here we go. Not a lot has changed. The Part A, the Medicare Part A in 2018, the premium, of course, is usually free, but if not, if you're one of the few people that are paying for Part A, the premium jumped to $422 a month. The out-of-pocket expenses, the cost for your hospital deductible is $1,340 for the first 60 days. If you are sick enough to be in the hospital on that 61st day, that goes up to $335 a day. And after 90 days, it goes up to $670 a day. But lucky for you, you're fed, because your fee-for-service plan, foreign service benefit plan, will pay for the deductible and the co-pays and that. Skilled nursing facility, of course, if you are discharged from a hospital after a 3-day inpatient stay, you go to a Medicare approved skilled nursing facility and are receiving skilled care. Medicare will pay 100% of that nursing home cost for the first 20 days. After that, beginning on the 21st day, your copay is $167.50 per day. And that is not completely covered by the Foreign Service Benefit Plan or any other Federal Employees Health Benefits Program plan. The Foreign Service Benefit Plan will cover up to 90 days of skilled nursing only, not intermediate, not custodial, and we will coordinate with Medicare. The Medicare Part B premium is always a maze. This year is no exception. They did change a few things. Now remember, the 2018 Medicare Part B premium is based on your 2016 tax year. We still have some of the held harmless issues that we had the last couple of years. That remains because we got a COLA this year. That also counts into the Part B premium. So if the increase was enough to pay for the difference between what was held back, the held harmless, and the new 2018 premium, then your 2018 premium was increased to the standard, which is $134, assuming that you do not meet the means testing criteria. If your increase because of your COLA was less than that, then your increase for the Medicare Part B premium was less than that. Medicare also changed some of the different sections as far as they lowered the amount by which the modified adjusted gross income could take place. So I have actually circled some of that. You can see that they've lowered these amounts for the last 3 amounts, so that the monthly premium for Medicare is higher at even the lower amounts. So if you fall into that category, you will be paying more for your Medicare Part B premium. The out-of-pocket cost for Medicare Part B hasn't really changed much. It increased a bit to $183 for your annual deductible. And we are also liable for the extra 20% coinsurance. So that hasn't really changed a lot. Extra billing, these are for what we call the non-participating providers. They actually do participate in Medicare, but they like to be called non-participating. And they can charge more than the Medicare approved amount, but there is a limit. That's the name, the limiting charge. And some of the plans will pay this extra billing, some of them will not. The Foreign Service Benefit Plan does pay for that extra 15%. But let's talk about the different physicians so we get a better idea of what they can and cannot charge. And this is a bit of a change, so we'll go through it. Now, if you're retired and over age 65 and you have a fee-for-service plan and Medicare Part B is primary, your Medicare Part B will pay first. So there's three types of physicians. I know you thought there were about 100, but there are really three as far as the Medicare program is concerned. The participating physicians are those providers that accepts Medicare assignment. What that means is that they will charge only the Medicare deductible and the coinsurance, that 20% coinsurance, and that is based on a Medicare approved amount, which is much lower than what they would like to charge, of course. As far as the non-participating providers go, these are what we call the limiting charge providers. They can charge more, again, but there is a limit, and it's usually about 15% more. Now, the Foreign Service Benefit Plan will pay that extra 15%. You would, if you are not a member of the Foreign Service Benefit Plan, I suggest you go to Section 9 in your health plans brochure and see what their rules are regarding non-participating providers. The private contract providers are these opt-out providers that have decided they absolutely want nothing to do with Medicare, and they have you sign an agreement that you understand that. If you have Medicare Part B and you go to one of these opt-out providers, the plan will not pay any more than we would have paid had you gone to a Medicare participating or non-participating provider. Bottom line is that we can only pay about 20% of that doctor's charges. Not good or bad, but you just need to understand that if you go to an opt-out physician and you have Medicare Part B, we will only pay a much smaller amount than what we would normally pay if you went to a participating doctor who participates in Medicare. I have a chart. I like charts because it really does kind of visualize this. So through my chart, you can see that the private opt-out doctors on the right in the right column, if that doctor bills $100, but the Medicare approved amount is only $80, and we will know how much the Medicare approved amount is. Medicare won't pay anything towards that. And your health plan, we, including us, would only pay 20% or our normal $160. So your liability very well could be $840. So I really urge you, when you make your doctor's appointment, please make sure you understand what type of physician within the Medicare program you're going to, so you can plan on how much your specific out-of-pocket costs are going to be. So this is new, and this is important. If you do not have Medicare Part B, for those annuitants who have chosen to not take Medicare Part B, this is an update on the physicians. Now, all Medicare participating and non-participating physicians are required by law to base what they charge, and we base our benefit and your coinsurance on either the amount sent by Medicare or the actual charge if it's lower. We can do this due to a law we call the Over 93 law, and it is the CFR 890.910 law. So your liability is limited, even if you do not have Medicare Part B. As part of the Federal Employees Health Benefits Program, they have to treat you as though you had Medicare Part B. But this is new with the opt-out physicians. Now, we have argued this point for years, that we considered opt-out physicians as part of a Medicare non-participating physician. OPM came down, they made a decision, and their decision was that opt-out physicians are not bound by this FEHB law. What does that mean for you? What that means for you is that you are responsible for the deductibles and coinsurance and co-payments like you are now, but also any balance that your provider charges. So that balance protection no longer exists if you go to an opt-out physician. However, remember, it's great to be a Fed. It's great to be able to take your federal health plan, especially the Foreign Service Benefit Plan, into retirement with you, because you get to keep the same excellent benefits. So just because a specific physician doesn't participate in Medicare in any way, doesn't mean they don't participate with your plan's preferred provider network, meaning in our case, Aetna. So you still enjoy the same discounts and coverage that you had as an active employee. If that provider, even if he is an opt-out provider, is one of our in-network providers, our benefit for our in-network benefit will apply, which is 90% of the discounted rate. So you are still protected through the contract that your provider holds with Aetna, even if he or she is an opt-out provider in the Medicare program. So you're still protected. I just needed to show you that little bit of clarification that came out late last year. Some of the Medicare resources that I have for you are listed here at opm.gov, ssa.gov, Social Security, medicare.gov. These are all really good resource materials, as well as it says here you can pick up a copy of the Medicare and Foreign Service Benefit Plan, and had we been in the office, you absolutely could. However, we just had a new one printed, and it is already on our website. So if you want one of those, you can definitely go to our website and download the PDF of Medicare and the Foreign Service Benefit Plan, and that will go through how this plan works with the Medicare program and how we pay in the event that you do not have Medicare Part B. Now, for those members who are still on the line and may not have the Foreign Service Benefit Plan, the other plans probably have very similar information on their website, and I encourage you to go onto their website and get that information about how that specific plan handles that. But all in all, so the Medicare Part B decision is always a hard one. I will tell you that most of our members have Medicare Part B. About 27% of you do not, but your federal health plan, whether it's Foreign Service Benefit Plan or any of the other federal health plans, works very well for you no matter what you have decided to do. And with that, I want to thank you very much for entering into the webinar. I hope that I was able to share some good information to you. I look forward to getting member feedback, and if I have not touched upon a subject that you asked for, we'll try to get those answers to you, or of course you can write us and we will certainly respond to you with answers as quickly as we can. Thank you very much. I hope you have a great day or evening wherever you are in the world, and thank you so much for your loyalty and for being members of the American Foreign Service Protective Association.